Let's define a few terms. If we define culture, cultural sensitivity, cultural safety, and cultural sensibility together, then we can be sure that we're talking about the same thing when we use those words. So what is culture? We propose the following as useful definitions of culture. Whatever it is that one has to know or believe in order to operate in a manner acceptable to a group's members, or defined by the person in relationships to groups they identify with based on heritage, individual circumstance, and personal choice. These definitions of culture may surprise you in some ways. In the West, in the dominant Canadian culture, and in most institutional cultures, culture is thought of as being explicitly attached to an ethnicity or culture of origin, and is something that's often made visible by physical features or perhaps through an accent in speech. These definitions are more comprehensive than that. The second comes from the American Association of Medical Colleges, or the AAMC. Using these definitions, you may see yourself operating across several cultures already. Your golf foursome likely has a culture. The knitting group you belong to, as opposed to all the ones you haven't chosen to belong to, has a culture. Your friends, your family, and your workplace all have cultures. You can layer your ethnic understanding of yourself onto all of these as well. The AAMC goes on to say that cultural identity may be affected by such factors as race, ethnicity, age, language, country of origin, acculturation, sexual orientation, gender, socioeconomic status, religious or spiritual beliefs, physical abilities, occupation, and many other factors. These factors may impact behaviors such as communication style, your diet preferences, health beliefs, family roles, lifestyles, rituals, and decision-making processes. All of these beliefs and practices in turn can influence how patients and healthcare providers perceive health and illness and how they interact with one another. So cultural sensitivity is knowing what the differences as well as the similarities exist without assigning values, for example, better or worse, right or wrong, to those values. Cultural sensitivity is one way to position ourselves in response to knowing that there are many cultures and many ways to understand the world around us. Knowing that there are differences, we can essentially do one of two things. We can decide that there are many ways to be, but only our way is right. Or we can know there are many legitimate ways to be in the world. We don't need to agree with every element of another culture to have respectful conversations, even across our differences. And cultural safety. Cultural safety is an outcome of interactions where individuals experience their cultural identity and way of being as having been respected or, at least, not challenged or harmed. Cultural safety is the outcome of dealing with a healthcare provider, or anyone, that's been culturally sensitive. If people feel disrespected, they are unlikely to seek out a similar interaction. When a young Aboriginal woman comes to you, concerned because her grandmother has told her that eating strawberries will cause her unborn child to have terrible birthmarks, how you respond to her will affect her feelings of cultural safety and, consequently, her desire to return for more care. Cultural safety is the goal of all of our interactions with patients and clients. When you put all this together, we get cultural sensibility, an openness to emotional impressions, susceptibility, and sensitiveness related to another person's moral, emotional, or aesthetic ideas or standards. This may sound academic or abstract, but really it's simply putting cultural sensitivity into practice. It's remaining open to the different ways that other people can approach or understand the world around them. It can have a real practical effect on healthcare when it is applied.